Hi, welcome back. Let's talk about valvular disease. This is part one. I will focus on what valvular disease is, the types, and the signs and symptoms related to each of them. In part two, I will focus on diagnostics, interventions, nursing considerations, and the mnemonic that you can use to remember which valve disease is had during diastole and which ones are had during systole. What do you think would happen if your heart valve stopped working? This shows normal working heart valve. The mitral and bicuspid valve opens during diastole when the ventricles are resting and waiting for the next contraction, and closes when the ventricles are contracting. The pulmonic and aortic valves open to allow blood to eject out of the heart, completing a heartbeat cycle, and closes when the ventricles are resting after ejecting blood out of the heart. So, imagine what would happen if one of the valves is not functioning. It could only mean two things: a regurgitation problem or a stenosis problem. As you go through the types and of valvular disease, I want you to keep this in mind. Keep the following in mind. First thing, locate where the valve is, then direction of blood flow in a normal working heart, then imagine then how the direction of the blood flow is affected with the disease present. Finally, note that if blood flow direction is disrupted, the end result will be that the cardiac output will be also compromised. What is a valvular stenosis? This is when, for some reason, the valve scars up or calcifies due to calcium deposits on it and it gets calcified and non-compliant. A stiff valve does not open fully to allow blood to flow out from one chamber to the next. Therefore, there will be some level of obstruction to forward flow. So, less blood is moving forward, more blood backing up. What is a valvular regurgitation? There is a valve that does not close fully when it's supposed to. Therefore, we'll be having backward flow of blood, so less blood is moving forward, more blood moving backwards. Okay, now I have a cheat sheet here that I use to remember which murmur is associated with which valve and when it happens. Mr. Pass helps me remember which common murmurs happen during systole when the heart ventricles are contracting. And then Mr. ARD or ARD helps remember diastolic murmurs. And I have another one, SAD or SAD. Aortic stenosis is SAD. SAD helps recall the classic triad symptoms in aortic stenosis, which include syncopal episodes, angina or chest pain, and difficulty breathing. You can also use the mnemonic ape to man to locate the valves so that when they ask you which murmur will be heard at the apex of the heart, you will know it's probably mitral valve stenosis or regurgitation. E in the ape to man is the Ebbs point. At this location, you will hear both S1 and S2 heart sounds. Let's talk about the diagnostics for valvular diseases. To diagnose any valvular disease, we will need, first thing, echocardiogram. Echo is the golden standard diagnostic tool. So if in the choices you're talking about valvular disease and the choices there is echocardiogram or echo, that's the answer. Echo evaluates valve anatomy, stenosis severity, regurgitation volume, chamber size, ejection fraction, and pulmonary pressures. There's also EKG. EKG can detect arrhythmias like AFib, which is common in mitral stenosis and mitral regurgitation. It will also detect chamber enlargement. Chest X-ray. Chest X-ray will show enlarged cardiac silhouette, pulmonary congestion, or if they are calcified valves, chest X-ray will be able to see it. Cardiac catheterization is used when echo is inconclusive. So with the echo, you're not able to see as much, so then they can go in and catheterize and all the way to the heart and see what's going on there. It can also help measure the gradient and pressures between each chamber. Stress testing, of course, you do stress testing for patients who are still stable and ambulatory. You don't do it to someone who is acutely ill and they cannot breathe. So stress testing evaluates functional capacity. So we already know you have a valvular deficiency, but we just want to see how far can you go or what activities can you do or how severe is it. So it helps determine symptom severity and surgical timing. So maybe we have like 6 months and then we have to fix it, or we have to fix it soon. Lab tests like BNP for heart failure severity. So remember, one of the lab tests that you will see when a person has heart failure is the BNP. When the heart muscles get overstretched, especially dilated heart failure, the muscles start to produce this BNP. So high levels of BNP, sign of heart failure. CBC for anemia, especially for patients like with aortic stenosis who are pushing out less cardiac output, so they might be anemic. Blood cultures if endocarditis is suspected. Let's talk about medical management for patients with valvular diseases. So medical management is used to control symptoms, not for curative purposes. So medications are just for control management, but it doesn't really take care of the main issue here. For valve stenosis, we can give diuretics for congestion, beta blockers or calcium channel blockers to reduce heart rate in the case of mitral stenosis, where the atrium hypertrophy and triggers arrhythmias like AFib, AFLARA, which can cause rapid heart rate. Patients will also be given anticoagulations, especially those who are in AFib. For regurgitation, valvular disorders, we need to reduce afterload since the heart muscle is already overstretched and dilated and weak. So reducing that afterload helps to make it easier for that ventricle to pump forward. Just making it less stressful to pump blood forward. Afterload reducers include ACE inhibitors, ARBs, diuretics, vasodilators. For all other, both the stenotic and regurgitation issues, we can do some rate and rhythm control if the patient has AFib or any sort of arrhythmia that is fast-paced. Antibiotics for infective endocarditis, because some issues can be caused by maybe infective endocarditis, and that's why the patient has insufficiency of that valve. So let's talk about procedural and surgical interventions. So these ones are the ones that fix the main problem. Medication management was just, we're just taking care, try to get you to the next day or, before you go to your procedure. But now we are talking about procedural and surgical interventions. Valvular repair, usually preferred when feasible, but some people cannot tolerate. They can annulate, put kind of like a stent, or we call it annuloplasty rings, or leaflet repairs. Valve replacements can be mechanical valves. They last longer, but the downside is that the patient will require lifelong anticoagulation. We can also do bioprosthetic valves. These are not mechanical. They are not artificial valves. These are more like, like some people use pig valve or human valves, and so they are less durable, because especially if someone has hypertension, because they degenerate so fast. So the good side is that they do not require anticoagulation while you have a bioprosthetic valve. Transcatheter procedures, for example, transcatheter aortic valve replacement, is done for patients who are high risk and they have aortic stenosis, especially elderly population, because they cannot stand open heart surgery. They probably do the transcatheter procedures. They can also do mitral clip for mitral regurg, or balloon valvulotomy used for rheumatic mitral stenosis. So balloon valvotomy, oh my gosh. Balloon, just the same way just the same way we do it when we have atherosclerosis. The same way they go push the balloon into the through the valve, and then they pump the balloon, puff it up, and it helps to open up that stiff valve. So balloon valvotomy. Finally, I was able to pronounce it. Let's talk about nursing responsibilities for patients who have valvular diseases and those who have gotten some interventions. So assessment, we monitor for difficulty breathing, fatigue, edema, chest pain, palpitations. Auscultate for murmurs, just to know which one the patient has. Is it at the apex? Is it at the second intercostal space, left sternal border or right sternal border? So wherever it is, we'll tell you which valve is involved. Mr. Pass or Mr. Ard. Those are mnemonics to use. Assess for signs of heart failure like crackles, JVD, weight gain, and associated with whatever you found. Monitor vital signs and hemodynamics, evaluate activity tolerance. In terms of medications, give medications as ordered. Also, you need to monitor the INR or PT-INR for patients with mechanical valves who will be on lifelong anticoagulations like warfarin, also called Coumadin. Watch for hypotension with vasodilators in case the patient is on some medical management. Assess for bleeding with anticoagulation like warfarin. And then with warfarin, patient has to be scheduled to go back to the hospital so they can draw some labs and keep an eye on the INR and PT levels. Make sure they are therapeutic. Also, we are going to be monitoring daily weights for the patient. First thing in the morning after they pee, we check their weight. We're going to keep a strict ins and outs, measuring whatever they take and whatever they pee. Telemetry for arrhythmias, monitor for pulmonary edema, watch for signs of endocarditis because endocarditis is an inflammation, so you'll see fever and a new murmur that wasn't there. Pre and post-procedure care. Give pre and post-procedure education, witness consent. Post-procedure, we monitor for bleeding because, this is a patient who's post-op. Most of the issues with post-op is usually bleeding, infection, hypothermia, all those things. Assess for cardiac tamponade, also called Beck's triad. So when you see Beck's triad, you just know this patient has cardiac tamponade. What is Beck's triad? There are three things: hypotension, JVD, and muffled heart sounds. Watch for arrhythmias like AFib. Neurochecks for patients with arrhythmias like AFib is very important because these patients can throw off a clot and it can cause a stroke. Patient education. Talk to them about medication adherence and why it's important, especially patients who have mechanical valves, that they have to take their warfarin faithfully. And of course, teach them about side effects of warfarin, which includes high risk for bleeding, and what they need to do, like using a bristle, avoiding a bristle toothbrush, or avoiding razors, instead using the electrical shavers. So also teach them when to seek help, like when they have difficulty breathing, chest pain, or palpitations. Teach them about diet and lifestyle, like low sodium intake, activity pacing, importance of follow-up echoes, and check-up for the INR, PT-INR levels. And also teach them about how to prevent endocarditis in the future. Patients with heart valves must disclose to their healthcare provider that they have an artificial valve. For instance, when going for any dental procedure, they must be given a prophylactic antibiotic before the procedure because these patients are at high risk for endocarditis. Last but not least, guys, special considerations when taking care of patients with valvular diseases. So, atrial fibrillation is common in mitral valve stenosis and mitral valve regurgitation. Any patient with AFib will require anticoagulants. So, like I said, any patient with AFib will require anticoagulation. AFib means the heart chamber is quivering. Oh, my voice. I think I might be catching something. Where was I? My apologies. AFib means the heart chamber is quivering instead of contracting and pushing blood forward. So the stasis in the atria can cause blood clot formation and therefore embolism of this clot to the brain, causing embolic stroke, or to the lungs, causing pulmonary embolism. So give prophylactic antibiotics to high-risk patients such as patients with prosthetic valves or mechanical valves, or patients with prior endocarditis to prevent valvular disease. Teach patients to notify their dentist that they have a prosthetic valve. They will be given a prophylactic antibiotic before the procedure. Calcified aortic valve is common among older adults as calcium deposits on the aortic valve over the years. This is a very common question. I've seen it so many times, like Aortic stenosis is common among which population? It's the older adults, because over the years, calcium gets deposited over there and then risk for having aortic stenosis. Because older adults have higher surgical risk, trans-aortic valve replacement is preferred as opposed to open heart surgery. Mechanical valve patients require lifelong anticoagulation with warfarin. Avoid high-risk activities since they are high risk for bleeding. As they take the warfarin, teach them to stay consistent with intake of foods rich in vitamin K. They should not reduce the intake or increase. They need to stay consistent. That sounds like a possible exam question, with choices telling you reduce. This patient is on warfarin. What do you need to teach them? A, choice A, increase their intake of spinach or vitamin K rich sources. B, reduce the intake. C, keep consistent. D, don't take any food sources with vitamin K rich foods at all. So this is a good exam question, and I've seen it before. So they stay consistent. Heart failure. Monitor for fluid overload. Educate on daily weight fast, checking their daily weights every day. Patients on heart failure, they take their weights every day, first thing in the morning after peeing. Also teach them to lower their sodium intake and, take life easy, no overstretching yourself or no just laying there couch potato. So teach your patient all these things, guys. Thank you so much for staying up to the end. I hope the content helped. Kindly support me by subscribing to my channel. It's free, guys. Thank you for your support, and those who have subscribed, thank you, thank you, thank you. And if you have not, please do so. And I appreciate you all. Bye for now, and I'll see you on the next one.